pictures and the videos that I saw of little children who were undernourished. I saw pictures of mothers who were suffering. We used to hear every day that so many mothers have lost their lives while they were trying to bring life into this world. And when we heard all these news and all these different data coming in, it really disturbed me. And hence we came out with this mother program. Meghalaya's outcome and transformation in health, education, rural development, social welfare. And that's when this acronym mother was brought in, which is very appropriate because the mother is actually at the center of all of these concerns. If we are able to get all our schemes that we are having and be able to connect them, able to achieve by pushing and motivating everybody to work towards the same goal, monitor them regularly, ensure that government also starts spending more if required. All these different kind of activities led finally to us coming out with a mother program. And we started, there were a lot of challenges. We didn't know how it would work out. Maybe for the first time in the country, there was an effort like this, where different departments came together. I selected our Principal Secretary, Mr. Sampat Kumar, to head this mission. And therefore, even though it was a difficult task for me at that point in time, to make him the head of Health Department and Social Welfare and c&rd, I still did it. Because there has to be one person who will understand the larger picture and then push the team underneath to be able to then go forward and push the frontline workers to achieve the goals. If the coordination is not there, if there are different people leading the different departments and teams, we will not be able to achieve it. And I'm happy and I'm glad and congratulate Mr. Sampat Kumar, the Principal Secretary and his entire team for having understood this entire mission, worked to ensure that we achieve this goal that we have in front of us and be able to take our state forward in respect of all these issues. A lot of people don't realize it today, but when the picture starts unfolding, then they start realizing. We started pushing the self-help groups. We said we need to create, we had 4,500 self-help groups. We said no, we should have at least 40,000 groups. And a lot of people thought that it's only about creating the self-help groups and they'll open up small units and they'll start looking at economic activity. Yes, that is a part of the objective. But then there was a much bigger goal and a bigger, larger blueprint of what we wanted to do. Because we realized that these self-help groups will not just work as self-help groups for their own benefit. These are institutional systems that we're creating. So tomorrow, if we want to achieve anything else, be it family planning, be it nutrition issues, these institutional setups of self-help groups will help us achieve those goals. And hence, a long drawn exercise of developing all these structures, creating all these systems, monitoring them started, and a long journey took over. And I don't want to go into details of all of that. It'll take a long time if I go into it. But I really want to take this moment to thank all of you. I want to thank all our frontline workers especially. This would not have been possible without you. This would not have been possible without your passion. It's not about you doing a duty. We all do our duty. But it is a sense of purpose that should drive us. And today, the videos we saw, the faces that we are seeing here today, there is a sense of purpose in your heart and in your mind. And without this sense of purpose, we will not be able to achieve what we are achieving. A 90% reduction in SAM and MAN children was unexpected. Nobody thought that this could happen, and least of all, nobody thought that Meghalaya can do it. Because people think that we are a small state, we don't have the capacity, or we don't have the will to do it. But we proved the whole country wrong. And today, the model that we followed is being studied by Niti Aayog, has been presented to the Honorable Prime Minister. The Prime Minister has seen this model and he wants a full report on this, so that this can be implemented in other states. This is a matter of pride for us, that today the work that you have done is been recognized even at the highest level, and that you have set the benchmark and a model that is going to be done and used and implemented in other parts of the state. Means what you have done here today will not only, or has not only saved lives in Meghalaya, but what you have done here today will save lives of children in other parts of the country. Can you imagine the impact of that? And that is really the sense of satisfaction that I'm sure each one of you is having, and I'm having today, that we have been able to set that benchmark and take it up the level and said that we will do it, and we'll do it better than anybody else. And today, I congratulate our Principal Secretary, the entire team of social welfare, because without your work, nothing would have been possible. And most importantly, I would like to thank and congratulate our Anganwadi workers who have really done so much to be able to, for us to be able to sit here today and look back and feel satisfied to some extent that we have been able to change and save lives of little children and of our mothers. And today, as I said, I know it's not enough. I know much more has to be done, but we will take it a step at a time. For the Anganwadi helpers, today we have decided to double their beneficiaries and their honorarium from 750 to 1500. And also for the Anganwadi workers, we have doubled the amount that the state government gives from 1500 now to 3000 rupees. So therefore, apart from the central government's amount, the state government, as I said, the share of the state government has been doubled, both for the Anganwadi helpers and the Anganwadi workers. And total amount, earlier we used to distribute and give honorarium of about 12 crores. This is going to go up to now 24 crores. So this is as a small token, I should say. I assure you that in the days to come, we will work together and we will try our best to ensure that other areas also are there where we can help and ensure that more and more support can be given to our Anganwadi helpers and to our Anganwadi workers. Apart from that, as you are all aware, all the Anganwadi centers will be now changed and transformed into early childhood development centers. Therefore, new infrastructures will come in, new equipments will come in, new methodology will come in, a complete system will change where we'll be involving the parents more. We'll be calling and we'll be consulting and giving them a lot of training. And this complete early childhood development program, which is approximately $50 million of an externally aided project which has already been launched, is also a very unique project in the entire country. And Meghalaya is again showing the way and leading the way in this early childhood development program, which I'm sure is going to go a long way in ensuring that we are able to improve the overall health of the children and the families as a whole. I also am very happy today that another important section of our society, the senior citizens, the single mothers, and the physically challenged citizens of our state, totaling about close to 116,276 of them. These are our citizens. They used to receive as a total amount of about 69.7 crores in terms of benefits every month. We have decided to enhance that, and now the amount that will be distributed to them annually has been increased from 69 crores to 104 crores. So this is a huge jump, and as I said, at the individual level, from 500, the amount is going to go up to 750 rupees. And more importantly, in the last 4.5 years, I'm sure most of you must have realized that we have also taken steps to ensure that this money gets to you on time. So giving the money is one part, but giving it on time is another part. So we will keep continuing and ensuring that this amount that has been earmarked and supposed to be received every month, we will ensure that the money is released in advance, as we've been doing in the last 3.5-4 years, and ensure that all of you are able to receive the amount on a much regular basis. Friends, while we say that, the last 4.5 years, the state government has worked dedicatedly to ensure that we are able to serve all sections of society, whether it's the infrastructure development that we have done. Today you're sitting in this hall, which has a capacity of 1,700. I think those of you who have entered here for the first time must be feeling that you're not in Shillong, because we never had a hall like this before. But not only this, there are about 2 more halls here in this place. And these are state-of-the-art infrastructures where we can host any program also in the future. Large projects that were there in the state which were pending for a long time, these have been completed in this government's time. In the last 5 years, we have constructed more roads than what was constructed in the last 20 years. So in 5 years, we have constructed more roads than what was made in the last 20 years. Our MG and REGS expenditure from 500 crores has gone up to today 1,600 crores. The Jal Jeevan Mission, where pipe water was there in only 4,000 houses in the rural areas, today we are touching almost 2.5 lakh houses in a matter of 2 years alone. And Meghalaya has been recognized as one of the best performing states in the Jal Jeevan Mission. And the Honorable Minister, in fact, when he came here, in his speech he said that this model that Meghalaya has adopted is something that other states should also try to copy the model or learn from Meghalaya in the implementation of Jal Jeevan and the overall water policy that we came out with, and ensuring that not just the pipes, but we try to protect the source and ensure that overall catchment areas are protected. So this holistic program development that was done has never been seen in any other part of the Northeast region or even the whole country. And hence Meghalaya in many sectors today is showing the way. Be it IT, we competed with large nations like China, like UK, like Singapore in the United Nations competition and emerged victorious as one of the best e-governance projects that has been taken up by any nation in the world. And hence this again is a matter of pride that today Meghalaya is not just competing with states. We are competing with international nations and we are competing at the international level. And this really has been the approach that we have tried to do. We tell our officials, we tell our team that we should never think small. And we should never think that we can't do it. I tell everybody, whenever I'm sitting in a large program like this, if we have to change things, the change starts with your thinking. The change starts with your mindset. You have to change your thinking and your mindset to believe that you can do it. To believe that Meghalaya can do it and Meghalaya can be number one. I keep telling people everywhere I go that we will be in the top 10 states in the next 10 years. We have a high goal, and some people maybe laugh at us. Some people even criticize us. But that's fine. We don't allow the noise to distract us, because we are focused on our people and on our state. We have a vision, we have a target, we are working towards it, we are moving towards it, and I can assure you that we will continue to do our best to ensure that Meghalaya becomes a model state. And while we do all of these things, we realize that it's not just the big things. It's the small things we do that matter. It's the lives that we save of the mothers. It's the lives that we save of the children. It's the farmers who will be able to get a better price for their products. It's the youth who today sometimes feel that they're not being able to decide how to move forward. These are the sections of society which this government focuses on. And hence today, after this program, I will be traveling to Garo Hills, to Jingjal, where I'll be having a very large meeting of the farmers. Yesterday was Meghalaya's Farmers' Day. We have declared December 4th as Farmers' Day for Meghalaya. And in this December 4th program, yesterday was Sunday, so we couldn't have it. So we are celebrating Farmers' Day today. And today from Jingjal, I will be distributing the Focus Plus program and the amounts of 5,000 rupees per beneficiary to close to about 60,000 farmers today from Jingjal itself, where we'll press the button and immediately electronic transfer will go into the different accounts of almost 60,000 farmers. And we intend to continue to register the farmers so that every year we are able to give this 5,000 rupees in the farmer's personal account and 5,000 rupees in the group account. Every year, 450 crores is what we intend to distribute to the farmers so that this money can then act as a pool and an infusion. And in the next 5 to 10 years, when this amount grows to 4,500 crores, 450 crores every year, multiplied by 10 years, can you imagine 4,500 crores being there in the different producer groups accounts, in the different farmers account, and you keep rotating this money, keep utilizing it and enhancing it, it will create a revolution at the grassroots level. And these are the kind of things that we wish to do. But as I said, everything doesn't happen in a day or in a year. Everything takes time. But what is important is we must have the vision, we must have the goal, we must have the belief that we can do it, we must be consistent, we must be patient, and we must work hard together as a society to be able to achieve that goal. It gives me immense pleasure once again to be here amongst all of you. I thank all of you for being here and all our friends who are watching us online today. This is indeed a really great and a very happy moment for all of us. I once again congratulate the entire team of the Health Department, the C&rd Department and the Social Welfare Department headed by our Principal Secretary, Mr. Sampat Kumar. And I would like to thank our Honorable Minister, Mr. Karmen, who is heading and leading the Social Welfare Department, for all his hard work and commitment to ensure that we are able to achieve all these goals that we have been in the last 4 years and work together to ensure that we are able to achieve having complete zero children who would be malnutritioned. So that achievement, that goal that we have in our mind, I'm sure one day we will achieve it with the help and the work of all of the officials and the team members who are present here today. So once again, I congratulate all the winners. I once again thank the frontline workers. I thank the team. And at the same time, I would like to thank all the self-help groups who are present here and who are watching us today online. Thank you so much. May God bless each and every one of you. May God bless our state of Meghalaya. Kublai Shigun, Mathela, and Jai Hind.